Hello and welcome. I'm Kathryn Tucker, a senior nutrition consultant for the Administration for Community Living. Is your organization struggling to meet the increased demands of feeding older adults and balancing your budget? Would you like to expand services and programs, but you struggle due to increases in expenses like staffing, supplies, and food cost? If you are, then I am glad you've joined us today. This webinar is part of a series to help the senior nutrition program with containing cost. And today's webinar is the fourth in the series and will specifically focus on introducing you to group purchasing organizations, which we call GPOs. Cost containment may seem like a new term. However, it covers strategies and measures aimed at controlling program expenses while maintaining or enhancing quality, services, and/or programs. It can cover various practices such as enhancing efficiency, negotiating, cost reduction, optimizing resources, and even adopting technology. And I know that sounds extensive, but cost containment is essential for ensuring financial stability and promoting sustainability of any nonprofit, government, or for-profit business. Depending on the size of your program, and food distributors in your region, you could have tools to enhance your buying power, which can enhance your ability to contain costs within your programs. Every dollar saved allows you to offer the best food possible, expand services, or offer some extras to make your program more special, like dressing up the table or dressing up the meal by using fresh produce to make your plate more colorful. It isn't just about saving money, but saving it and being able to offer the best quality with the most effective delivery. And we know that studies have shown the second most important reason people attend the congregate program is based on the quality of the meal. We see increasing numbers of generations and diversity within the older adult population. With that comes changes in expectations and increased interest in flexible meal delivery, which we in the senior nutrition program are growing more accustomed to, mainly due to all the new innovations that's being created every day. Couple that with the increased cost of doing business, we have to continue to be realistic. It is important that when we're looking at our budgets, we should focus changes that don't limit the human factor for which our programs are intended. Finding innovative ways to maintain or enhance service levels while folding in cost containment methods is crucial for staying sustainable in this ever-changing environment. Now, I'm thrilled to introduce you to a wonderful speaker to help introduce you to GPOs and help you to navigate the cost containment challenges you may be facing. Dr. Shirley Chao retired from the Massachusetts Executive Office of Elder Affairs in 2021 after 32 years of service, which she built and led the nationally recognized nutrition program for older adults. Currently, she is on the editorial board for the Journal of Nutrition and Gerontological and Geriatrics. She is a journal reviewer for the Journal for the Academy of Nutrition and Dietetics, a member of the expert panel for the Malnutrition Learning Collaborative, and a founder of FoodPolicy Insights Consulting. She served as an external reviewer for the 2020-2025 Dietary Guidelines for Americans, and she's received the Excellence in Nutrition Award from the Friedman School of Nutrition Science and Policy Tufts University in 2022. She's also received the Lifetime Achievement Award for Massachusetts Council on Aging in 2021. Dr. Cho has received her doctorate degree from the Friedman School of Nutrition Science and Policy of Tufts University, and she's a registered dietitian and a fellow of the Academy of Nutrition Dietetics. Today, Dr. Cho will be presenting GPO 101, Approaches to Control Food Costs. This is our introductory webinar to group purchasing organizations. Dr. Cho, thank you for being on the call today. I look forward to this presentation, so I'm going to turn it right over to you.
Thank you, Kathryn. Hello, everybody. Thank you for the introduction. We have a full agenda today, so let's just start from there. We are going to touch about the factors affecting the food cost, controlling food cost, and if you choose purchasing as one of the ways to control food cost, and what are the areas you need to pay attention. There are several factors affecting food costs. I think you are familiar. The number one is inflation. The food prices going high, gas going high, the meal costs went high. Labor shortages shifting customer preferences, lack of control over caterers' price increases, and also decrease in meal numbers. I know you went through a lot of exercise on how to control food cost. I just like to re-emphasize certain areas. One is nutrition requirements. So focus on key nutrients to optimize your nutrition value. Try to not get into the micronutrients that will raise your cost. Quality, a wholesome, safe product is the best thing. It's a basic standard. Instead, get into very elaborate standards. Menu planning, I always recommend that you implement standardized entree mix matrix system, which that means is if you know you serve chicken every week, you serve beef 3 times 2 weeks, so you know your protein requirements. That means you use the same menu, but the raw ingredients you know. In that way, you can make more updated menu adjustments to minimize the impact on cost increase. If the beef price go high, you move into more chicken or vice versa. Meal numbers, I highly recommend that the smaller programs, you form a consortium. You can purchase the product, you can purchase the service, and also you can consolidate a lot of administration matters. The waste minimization, I think the first thing come to mind is reservation system. So you don't need to overproduce. Also to control your inventory so you don't get money on the shelf. Enhanced buying power, that's what we focus on today. And the last thing I would say, the labor optimization. Spend some capital money to buy good equipment to distribute the labor effectively to streamline your operation. Okay, so now let's talk about purchasing. As you are aware, there are many stakeholders in the food purchasing field, the whole supply chain involving many people to try to get the end consumer. This is a supply chain flow chart. I kind of show you from the growers move into the manufacturers. They make the product into a wholesale package, everything give to the distributor. In between, maybe you see a food broker, they help to move the product along, then sell to the buyers. There are 3 types buyers in our business. We go one by one. First is a self-operated kitchen. The good thing is you have the autonomy in all the decision making. You may be even flexible on the payment schedule or minimum order requirements. But the good things sometimes turn bad because you don't have a strong buying power. The price go high and you are very vulnerable when the inflation happens. The second type kitchen is a contract food service company. So you contract a company, you never really pay the product bill, you pay the meal cost. And you rely on the food service company, their buying power to get a better price for you. What's happened is like during COVID, even after COVID, they come to you and said it's a product shortage or we need a price increase. They can ask you more frequently or in a higher percentage. You have no control over anything. The last thing is you join a food purchasing operation. Okay, so now you are with the big guys. You have a big volume. You can get a good price. But remember, nothing comes free. Okay, for someone get a better price for you, you have to pay. Okay, another thing is they have to comply with a lot of requirements to be able to get that price for you. So let me just give you how the price setting works. So a farmer would just say $2 a pound. Farmer sell to a manufacturer. So the manufacturer started cutting the product, clean the product, make that into a format can sell, or it's a process and they have to add ingredients. So the box with every ingredient with all the process, that's called bill of material. Then the equipment, the labor, the facility, everything add together, that's the total processing cost. On top of that, they add in 15 to 20% profit to sell to a distributor. So the distributor gets this product, purchases product. They can mark up from 5 to 40% difference. They have a lot of flexibility. Depends on the volume, depends on how frequently you use it, how fast you pay. That's all the factors. The GPO and the food service company all come in, try to get a better price for you. But two things you need to remember. GPO is designed to save money, but they aren't free to join. So some is pay a member due, some is your purchase plus percentage. And also they want you have less delivery, bigger quantity, and also pay faster. The food service company, yes, they can get a better price for you through their buying power. But remember, everything you save, they will add into their profit. So during this entire price setting, there is no free. Every step, they're adding on a little more. And the broker is paid by the manufacturer on commission. So when the manufacturer sell the product to the distributor, they build their broker fee into it. There are basic four ways. Okay, one is hybrid to purchase, how we purchase. So we will go one by one. The first one is a procurement purchasing. You do a single or multiple items. The food service or the kitchen director, sometimes it's a business manager, will issue a verbal or written procurement to multiple distributors. Obtain a bids through competitive or non-competitive bidding process. Then purchase based on the price comparison and procurement requirements. Let me give you an example. If you want to have 100 cases, 2% milk, 50 cases, 1%, and another 50 case whole milk. So you give this to everybody. So they submit a bid to you. Then you start compare, this one is higher than 2%, this one is lower than whole milk. So you compare, find the best price. This kind of purchasing really is not long-term price set up. So you have to do more frequent. Weekly, monthly, you do more frequent. It's very labor intensive. And another thing is you never see the whole picture because you're bidding on item by item. I think it's a lot old traditional way to use this. This is, I think you all see this. You list what you want, the cases, and they give you a price. Then you go from there. The second one is a co-op buying. You heard about co-op buying. Co-op buying model is allow group buyers with a common interest to pool their buying power to negotiate a more favorable pricing on goods or services. They spread the burden among their members. Okay, so they don't hire somebody, they basically everybody shares something. Co-op business are owned and controlled by the members. Member of the co-op business pay a lower or set up fixed price to enlarge their buying power through their buying power. The profit of co-op, sometimes other people join in with a little small fee. The profit is shared by the original members. So the consumer co-op, you heard many times, the school food service co-op, healthcare co-op, and even housing co-op. This is something I just want to share, give you an idea what it means co-op. This is Massachusetts school co-op. This is their bid. So on the left hand, you see when they want to purchase, this is all the beef product they want to purchase. They list who is the broker and they list the description and the projected cases. So they give this whole package to different distributors. So the distributor go to work with the broker, get a better price. Then they put everything together. What they do is they figure out what's the markup. If I'm the co-op at the school, we get a lot of bid from different distributors, and you'll find the best value to give the contract to. Next thing I like to, that's actually what's the title today, the GPOs, the Group Purchasing Organization. A group purchasing organization leverage the combined purchasing power of its members for bulk procurement of goods and services. They negotiate with the suppliers on behalf of the group. So they aim to secure cost-saving, favorable items, and other benefits for their member. So they are organization. They pull all the buying power together on volume. The minimum order and payment timeline always required. And most time they want online ordering and tracking so they know what to get off the list and what to add on the list. And also they give you a lot of support, sometimes help you to procure your other things. The factors to consider GPO, the suggestion use 1 month invoice. I always recommend people use 2 months invoice. Take your invoices, put it side by side with the GPO's price, compare item by item. Then look the nutrition value, look the product quality. So sometimes they may have a better product, sometimes you may have a better product. So compare every single thing you purchase in the 2 months. Then you see exactly the saving it's at. Check, do they have a minimum order? Do you have the capacity to store those things? Do you have that much? How frequent they come to you? They come to you every week or they do a monthly delivery? Payment requirements, how soon they want you to pay. I think 45 days sounds reasonable, but in our business, sometimes we don't do that. So you need to meet that requirement. How long the price set up and how frequent they will change the price. Any additional value, they teach you how to do online ordering, everything. Then we talk about a membership or fee structure. The membership, sometimes it belongs to an organization. You pay that organization as a member. Then the organization sign up a GPO. So maybe free to the GPO, but you have to pay the membership fee with the organization. Or you pay the GPO. They normally take 3 to 4% of your sales. So think about if you purchase $100,000, 4% is $4,000. You pay the fee. After you compare your invoice, you save $6,000. By joining this, actually you save $2,000. That's when a smart operator you need to consider. The best example for the Senior Nutrition Program GPO is the Meals on Wheels Americans program. They have a contract with a large GPO and their member all have the access to that GPO. According to MOA, give me some fact I want to share with you. The GPO they have has a portfolio over 2,000 contracts. The contract have been able to drive out over 50% of inflation costs over the last 12 years, and the saving is about 70% of the invoice pricing. But you need to figure out what's in there for you. The GPO put together the fixed price at least 3 years. That's very good because you need to lock into that price for long term. Another thing is over 400 price agreement, so you can buy the office supply, cleaning supply, or IT equipment. The members also receive rebate. The more you buy, you get cash back. Because they track the fact, so they know after the COVID, a lot of small kitchens start using frozen meals, and also most popular is speed scratch. That means you just add a little bit more, you can get a product. I think it also related to the food labor shortage, which means the GPO can reorganize, get those products for their members. The difference between co-op and the GPO, I think at this time you're pretty clear, is their purpose. The purpose to a co-op is they are united people in a jointly owned, vertically focused and operated business, resulting in a lower price on their offered service or goods. Okay, but the GPO is different. It leverages thousands of companies' committed volume to secure discount on their purchase needs. Another thing is if you join a co-op, you only can purchase what the group sells. But if you join a GPO, you had a wide variety. I like to say the GPO like a department store. You walk in, you see a lot of goodies on sales, everything good, everything you want is there. But you need to keep in mind is the things on sale is what you want. What do you want? Is there really a better price? That's what you need to think. But also, they do have everything you want. The last thing I do want to mention is a hybrid model we did in Massachusetts all the years I was there. We started 1999, 1990. We built on the commodity processing program. We use a commercial distributor, and during years the policy change, we move more into the purchasing program. It's a hybrid. We use the both GPO philosophy and the co-op philosophy. We most time can get 15-20% lower market price. There are some special character. I think that's also something you can consider. One is direct negotiate with the manufacturer. We bring our nutrition spec and quality requirements to the manufacturer. We tell them we have a volume. Every time we use one product, we have 7,500 pounds. So I mentioned earlier about the entree matrix system. So if we serve every week, we have 52 times use 7,500 pounds. So willing for the manufacturer to make something too suitable for our needs. As you're familiar with seeing a label, child nutrition, they require 2-ounce protein. We want a 3-ounce. We want a lower sodium. They're willing to make because the volume. Then we select the distributor. We select a smaller distributor so they can cover our state. I think some of you have a large state, maybe do regional, doesn't need to do statewide. This way, the local guy get a business and he's more flexible to take a less markup. And sometimes we work back up. This is a price we can afford. We work step by step. So if any of them can take a less 1%, 2%, 3% to reach our desirable price. There is no rebate. You buy more, you buy less, same price. The 5,000 people's caterer's kitchen get the same price as my 10 people's kitchen. And we use strategic purchasing by connecting on essential, our high profit items. We use more protein items. The challenge is everybody have to agree, use the same thing. You can serve chicken every week. You can do sweet sour. You can do barbecue. You can do Parmesan. You can do anything. But the raw ingredient is same. That's how we can negotiate the price. There is no fee because the state oversees it and also select a focus. This is outer form. I just want to show you how we do. And I think now Tyson sell chicken meatball everywhere, but the time we add some process it, it's a lower fat, it's better price. At beginning was a challenge, but now our seniors have to have chicken meatball. And we do the ordering months ahead. So this way the distributor, the smaller guy, doesn't need to spend the money. He get the order before he purchase. That's also another way he can knock down some percentage. In closing, I want to say there's many ways, and now Kathryn been working on to do food cost control. So think about it. You did every step, try to control that cost. If you choose purchasing is your way to do it, review all the strategies, find the best one to fit you, and be a very smart operator to make sure the cost is reasonable. Your saving is really saving. Then make the best choice. And I think do the great job you've been doing. Feed many people you can with the limited the funding we have. Thank you very much.
Thank you. I want to ask you a few questions, or just a couple of questions. And these are some questions that can come from our network. What is the best step for providers when reaching out to GPOs?
You mean when they reach to a GPO?
Yes, when they want to start the process, what is the best first step whenever they want to reach out and start that process?
I think they should start to explore a little bit what the GPO there. Every GPO I think have a different charge to join it, but also go through the list we have and review everything is the best for you. How big your kitchen? Can you take delivery slower or something? But the most important two things is cost. You do need to do some homework, take your invoice, compare the price. Because if they offer, I think it's some GPO called restaurant GPO, they offer a lot of things. It's not suitable for the program. So you really need to compare your price, what your invoice purchasing with the GPO offers.
So that kind of answers the next question, but you may want to elaborate a little bit more. What is the top three things programs should look for when considering a GPO?
Okay, then we go back again. Get your invoice put together. Okay, are the stable, the fresh, the frozen, our product. Then ask the GPO give you their price structure and their nutrition, the product spec. So you sit there, do some homework, really calculate, see the 2 months, how much you pay if you join a GPO, how much you pay. So you know the savings on the actual purchasing. The second thing is find out the fee. Okay, if you join a group, what's the membership fee? Other benefits going into it. If the GPO charge you on your purchase and exactly your yearly purchase on the percentage is, then you look how much real saving you have. And then two things, right? I give you one more. And I think the one more to me is more important is your capacity. If they only do once a month delivery or they have a minimum order 60 cases, you never can use it, then you cannot join the GPO because it's it's a good thing, but it's just not suitable for you.
And that, I want to thank you so much for all this important information and answering those very needed questions. This really provides our audience and the network with the beginning processes of understanding and considering group purchasing organizations as a potential option within the senior nutrition program. Some senior nutrition programs have been using them for years. Others don't even understand what they do. So I think this is a wonderful start to really spread that information out a little bit more wider within the network. In this evolving environment, our network must continue to not only be nimble in its service delivery, but also business savvy to continue to serve the growing older adult population while controlling the overall cost of services. Many within our network have found business management and cost containment skills can help ensure successful and sustainable operations, resulting in more people served while maintaining higher quality programs. I encourage you to visit the Nutrition Aging Resource Center webpage at acl.gov /senior nutrition. You can click on Browse Resources and then go to Business Management. And from there, you will find a library of resources that includes things like business skills, contracting, finances, cost containment, and much more. In the cost containment page, you can find companion pieces such as fundraising for sustainability, you have guides, you have toolkits, many presentations, including the recordings from this webinar series. And be on the lookout. We have one more webinar coming in this series, and that should be coming soon to the website. And I've also included the contact for Dr. Chao is up on the screen, as well as the web address for the Nutrition Aging Resource Center. I want to thank you for joining us today for GPO One-on-One Approaches to Control Food Cost. I hope you found this information helpful. Please reach out to either one of us if you have any questions. I hope you have a great day, and I can't wait to see you at the next chat.
Thank you.